Hello everyone, welcome back to Believer Science Academy, Bengaluru. In today's topic of the day discussion, we will be discussing shifting from curative to preventive healthcare. Why should India shift for preventive healthcare from curative healthcare? Okay, so the reasons are it will improve the health outcomes, that is, early detection and management of diseases like diabetes, heart disease, and cancer, reduces complications and improve quality of life. Okay, as it is always said, prevention is better than cure. Okay, so the remuneration or the financial cost of curative healthcare is higher than the preventive healthcare, because if you are identifying a disease in its early stage, you can prevent it before it can express itself in a deadlier stage. Okay, so preventive healthcare can increase the lifespan and reduce the severity of chronic illnesses. Okay, so earlier the detection, earlier it is easier to cure it, or earlier is it to prevent it. Then it is cost savings. As I told you, preventive measures reduce the need for expensive treatments and hospitalizations. Lower healthcare cost ease financial burdens on households and the government. Okay, so when there is a lower healthcare cost, there will be less out of pocket expenditure. When there is less out of pocket expenditure, then there will be more disposable income. When there is more disposable income among the people, they can focus more on improving their quality of life. Okay, so if there is if the cost of power out of pocket expenditure high, then there will be less disposable income, and then they will have less amount to focus on other aspects of the life. Instead, they will be spending their life spending on the healthcare, and like they will be moving from common family to a common household to a poor household. Okay, so preventive healthcare helps in this aspect as well. Then it will reduce the healthcare system burden, that is, preventive healthcare can elevate pressure on India's overburdened healthcare infrastructure. Okay, India's healthcare infrastructure is already overburdened. The curative healthcare infrastructure requires lots of infrastructure, from PPE kits, doctors, nurse, beds, hospitals, etc., which are very costly in nature. Therefore, it is crucial for managing non-communicable diseases such as hypertension, blood pressure, etc., which account for around 65% of deaths in 2022. If we identify these diseases in the earlier stage, then it will be easier for us to reduce the cost of healthcare as well and reduce the burden on the healthcare. Then, enhanced economic productivity, that is, a healthier population leads to fewer sick days and productivity and sustained economic growth. Okay, meaning there are more working days. If there are more working days, then there will be more better better equipped to provide for the economy as well. Okay, higher healthier days, higher will be the productivity. If the productivity of individual is high, then his contribution to GDP is also going to be high. Okay, so it has a virtuous cyclic effect there. Then chronic illnesses impact workforce participation and economic output of a particular institution, organization, and at a country as well. So, addressing the rising disease burden with non-communicable diseases affecting people earlier in life, prevention is key to sustainable healthcare management. Okay, these days India is having a shift in its disease trend. The disease trend is moving from communicable disease to non-communicable diseases. What are the communicable diseases? Such as malaria, TB, and other things, typhoid, etc. Non-communicable diseases are also called as lifestyle diseases. Okay, so lifestyle diseases are easier to prevent rather than non-communicable diseases. Okay, so India should focus more on preventive healthcare in this aspect. Then, how can India effectively shift to preventive healthcare? Then we saw the importance of preventive healthcare. Then how can India shift to preventive healthcare? That is, strengthening early intervention. That is, empower Ayushman Bharat Health and Wellness Centers for early disease screenings and targeted interventions. Then use data analytics to identify and address high risk populations. Okay, that is inculcating or implementing technology as well. Use of artificial intelligence and big data analytics to identify and address high risk populations. Okay, this will help in identifying large number of populations at the earlier stage of diseases. Then encouraging regular screenings, that is, you should promote screenings especially for individuals aged between 40 to 60 to detect conditions early. Okay, if you are detecting the conditions earlier, then it will be easier for you to prevent it, or easier for it to treat the disease in the earlier stages itself. Collaborating with private healthcare providers and insurers to make screenings affordable and accessible. Okay, so in order to provide screening and screening more affordable, we should include more people in the health insurances. Presently, around 38% of India is covered under one or the other healthcare system. This should be increased to around 70%, and then there will be more number of people which will be covered under health insurances, and then they need not worry about the cost of screenings because they are insured by the insurance companies. Okay, then policy incentives, that is increasing tax deductions for preventive healthcare checks from 5,000 to 15,000 under section 80D of the income tax act. Okay, so these policy incentives can help people to go for more preventive healthcare rather than curative healthcare. Then introduce subsidies for preventive care services, particularly for vulnerable groups. Okay, you can also introduce subsidies, that if you are going for a preventive healthcare, then the cost of preventive healthcare will be provided by the government. A substantial amount of cost will be provided by the government as subsidy. That will help and that will encourage more people to go for preventive healthcare checkings. Then here we also talk about role of technology and innovation in preventive healthcare. How can technology and innovation be included or inculcated in preventive healthcare? First is artificial intelligence and digital healthcare solutions. That is use of AI for low cost accurate imaging and diagnostics. Okay, we can use artificial intelligence which works on the basis of patterning, that is the data already available there. It can identify a particular pattern and it can identify disease at the earlier stage itself. Then telemedicine can expand access to preventive care and in undeserved areas. Okay, instead of people trying to get access to the physical infrastructure, they can use the telemedicine, that is they can use the mobile phone in their hand. They can get the access to telemedicine through their mobile phone itself, living in a remote corner of the world. Then National Digital Health Mission is one of the key missions of the Indian government, which will enable effective health data management to track population health tracks. Okay, health trends. Okay, how the population of the health of the population is moving towards, whether it is moving towards the non-communicable diseases, or whether being affected by genetic disorders more, or whether they are being affected by lifestyle diseases more or more. Okay, then for this use analytics for targeted interventions and better resource allocation. Okay, that is analytics can be done. Big data analytics can be used here to study this population health trends and then devise a policy which can target which can have a targeted interventions for a particular grouping, which will be more efficient and it will also result in efficient resource utilization. And then technology in wearable health devices, that is promote the use of devices that monitor vital health matrices. For example, there can be a digital watch which will study the blood pressure, which will study the heart rate, etc., etc. Then encourage individuals to take proactive health measures leading to early detection of the issues. Then what will be the expected outcomes of prioritizing preventive healthcare? Okay, we already discussed this. The advantages of the preventive healthcare are the expected outcomes, that is it will reduce the healthcare cost, that is early detection minimizes expensive treatments, lowering financial burdens on households and healthcare systems. Then better health outcomes, that is decreased morbidity and mortality rates associated with the non-communicable diseases will reduce. Then it will improve the quality of the life of population. Then It will also result in economic growth and stability, meaning the healthier the population, higher the economy. Okay, so if the health, if there is a better health outcomes, then there will be improved life quality. If there is an improved life quality and health, then there will be higher productivity as well. So reduced productivity losses due to fewer sick days and chronic illnesses will increase the economy. A healthier workforce drives economic growth and reduces healthcare expenditure. Okay, so there will be more growth and less expenditure, which is good for overall economy of a country. So moving forward, we should expand preventive healthcare infrastructure, that is strengthening primary healthcare centers with early screening capabilities. Okay, we have to increase the infrastructure at the primary level itself, so that people don't have to go for the secondary or tertiary healthcare institutions for getting the mere checkups. Collaborating with private providers to offer affordable and accessible preventive healthcare preventive services. Then leveraging technology, that is promoting wearable devices, telemedicine, and AI-driven diagnostics for early intervention. Then enhancing awareness about preventive measures using digital platforms. Then incentivizing preventive practices, that is revise tax benefits to encourage regular health checkups. Implement public campaigns to raise awareness about the importance of preventive healthcare. Awareness or informed citizenry is better than non-informed citizenry. Okay, a informed citizenry would take decisions which are in benefit to himself as well benefit to the nation as well. Okay, so there should be more campaigns which are aimed at incentivizing the public as well as encouraging awareness. So this is about today's topic, very significant topic, especially from mains and interview perspective. For more videos like this, then like the video as well as subscribe to the channel. With this, we'll end the video. Jai Hind.